Hi everybody, welcome to you in Poultry Extension channel of Engineer Rifat Khater. Today we are going to talk about an important viral disease of chickens, it's infectious laryngotracheitis, ILT, which affects the unvaccinated flocks of chickens starting from the 6th week of age. This disease causes great economic losses to producers as a result of the high mortality that may cause and the decrease in egg production in laying hens. This video contains etiology, transmission, clinical signs, gross lesions, prevention and treatment methods. This disease is caused by one group of herpes viruses. It spreads in the cold winter months and it decreases in the hot summer months. These viruses are very weak outside the bird's body, as direct sun rays kill them in a few minutes, and any disinfectant, such as phenic or iodine, kills them in a few minutes also. Transmission. The infection is transmitted from the infected farm to the healthy farm through the air. The infection from bird to bird occurs through the upper respiratory tract or the mucous membrane of the eye. Also, the infection occurs by mice and wild birds that carry the virus and don't show symptoms. Also, the infection occurs by used feeders and drinkers, shoes, clothes, cages, egg crates, visitors, and etc. The infected birds that excrete viruses with secretions released with coughing or sneezing. Vertical infection with this virus does not occur, as it is not transmitted from infected mothers to hatched chicks through eggs. Incubation period. The incubation period ranges from 5 to 12 days, and the duration of the disease in the flock from 2 to 4 weeks. Clinical signs. 1. Acute infections. Symptoms appear in the chicken flock suddenly and spread with 1 to 3 days. Mortality rises to 50 to 60%, resulting in suffocation and extreme fatigue. Symptoms are initially in the form of coughing, sneezing, nasal discharge, and swollen watery eyes, then difficulty breathing and dispersed cries in the house from infected birds as a bird tries to breathe by opening its mouth to the end of its neck forward during inhalation, then closes its eyes and lowers its head down during exhalation. Some infected birds succeed in expelling some blood mucus from the trachea, and therefore blood mucus is seen on the lower part of the house wall in some places. Egg production in laying hens reduces suddenly to 25 to 35% of its normal production and then returns again after 1 to 3 weeks from the appearance of symptoms. 2. Subacute infection. Subacute infection occurs after acute infection in the same farm and may be subacute infection when it appears in the flock. The mortality is as low as 5 to 20%. Symptoms appear on the flock slowly over 2 to 3 weeks as the larynx becomes inflamed and the trachea becomes filled with bloody or non-bloody mucus. Respiratory symptoms appear on some infected birds in the flock: reduction in feed consumption, reduction in egg production in laying hens, but it returns again after the disappearance of symptoms. 3. Mild infection. Slight respiratory symptoms appear on some infected birds in the flock, and the disease continues in the flock for weeks or months, and the decrease in egg production is limited, and the mortality will not exceed 1 to 2%. Gross lesions. Gross lesions appear in larynx and trachea. In case of acute infection, severe laryngitis occurs and the trachea is filled with blood mucus. In subacute infection, The severe inflammation occurs in the larynx and the trachea. The trachea is often filled with mucus that is not bloody and may be bloody in some cases. Also, in some cases of subacute infection, cheesy materials called diphtheria are present in the upper third of the trachea after larynx immediately. Prevention. The following preventive procedures must be taken. 1. The infected birds should be isolated and slaughtered, and if the number of the flock is small, it is preferable to slaughter the whole and disinfect the farm. 2. On large farms, healthy birds in neighboring houses should be vaccinated. 3. The only one-age system must be followed on the same farm. 4. When the disease appears on neighboring farm, it must be isolated and prevented from entering non-workers, and disinfectants must be placed at the entrance. 5. We must prevent means of transmitting the infection, such as mice, wild birds, chicken cages, egg crates, used feeders and drinkers, etc. 6. Flocks of chicken must be vaccinated against ILT disease in 2 doses. The first dose, live ILT vaccine at 4 to 6 weeks of age, ocular installation. The second dose, live ILT vaccine at 12 to 14 weeks of age, ocular installation. Treatment. There is no treatment for this disease, but the following procedures may be helpful in reducing mortality and the associated secondary infection. 1. Using oxytetracycline 20% has a rate of 20 mg per bird for 4 to 5 days to reduce the associated secondary infection. 2. Using vitamin K3 has a rate of 2 to 4 mg per bird for 4 to 5 days to reduce tracheal bleeding. 3. Using vitamin A3 has a rate of 3,000 to 5,000 units per bird to help in regenerating damaged cells. 4. Spraying birds at night with any volatile oils, such as menthol and eucalyptus, to aid the infected birds to cough and sneeze, for expelling mucus secretions that obstruct breathing. Finally, thanks so much for watching. Don't forget to press subscribe, like and share. If you have any inquiry related to this video, please comment and I'll reply with suitable answer. I'll see you in the next video. Thank you.